What do you think people are afraid of with the perceptions, with friends and family and employers?
I think what they think once a year mental health or mental illness, then people or the people's perception think that person is mad. He cannot function on his own. But it's not like that. Because that person is still a human being. He still has feelings, he still has his thoughts, and he can still work. He can do everything that you and me can do. It might just be that in a particular part of episode in his life, he couldn't handle all the stresses that the life threw at him.
And people don't really feel seen when they're suffering from any sort of mental illness, or they're going through a rough patch. What does it take for them to? How many steps have they taken by the time they come to see Sister Hendricks at mental health services at Retreat Hospital?
Sorry. So if I look at, so many of the people or the patients with anxiety and depression, they come with somatic disorders like chest pains or headaches. I'm fatigued. I just cry for no reason. But they don't come to me, they come to a doctor. And then, or any other, like chest pains can be you're having a heart attack. But you continuously coming with the same, or shortness of breath, which is actually symptoms of anxiety. But now you come, you keep continuously go to trauma. So now the medical officers do all the medical workup, and then everything comes out negative. So it's not your heart. It's not whatever they thought it is. So which means it's all in your mind. And sometimes it's even hard for the patient to accept what the doctor said. Because there's patients that come in when I ask you, do you know why you're here by me today? No, I was just crying there by the doctor and he said, I must come speak to you. No, things like that. So even the patients themselves, they don't realize, or especially in our community, because everything is just like, it's normal. This is just the way how my life has been all the years. And what might be normal to you, it's not normal to me. That's why normal is relative. Because I can say, no, he's been talking all his life, he's been talking to himself. But it's normal. Then I say, but that is not normal. How can that be normal? It's not normal if someone is talking to himself. No, we leave him like that. And so even his own family members, his or her own family members, or even the community, they would rather make fun of that person walking in the road, talking to himself, than actually reaching out and say, are you okay? Don't you think, do you know there's help here? You can go here, you can go there. There's a lot of places in the area, in our community.
And that's where the stigmatization comes from.